Problems encountered from Communitites. Community representatives, Commune Councils CC members and community people joined with LHCCO to update the understanding on the livelihood situations for those living in the LHCCO's target community. A number of areas were identified and discussed. The following areas had identified various issues on agriculture production or food security, off-farm income generation, health condition, social awareness and social links, as well as environmental natural resources management. Details on the assessments in each of these areas are given below. Agricultural potting food security. Agricultural cultivation is the main activity of the farmers. But up to date, they still do not produce enough crops to support their own family. These families have the only land and skills to grow one crop per year rice, as they own no land or property. These families only depend on one option on making the very small businesses, and their kids are to go out for scrap scavenging to survive. Then, kids get no time to attend school due to the poverty as they are living from hand to mouth. Off-farm income generation. A number of community people are economically active, but this activity is generally on a very low scale, because of people's lack of means and capacities to improve their business. There are options for small business in the villages, but the people have not access to skills training to do business in. For example, bike repair, barbering, sewing, carpentry, mat weaving, etc. Villagers supplement the income for their families by selling their labors. They take on work given by local people, but with low payment. Other villagers leave from their homeland to work in Phnom Penh as factory workers, bartenders, beer sellers, and sex workers. Some of the poorest, when they are in times of crises, must sell their farm animals and ore or land. They may also take loans moneylenders at high interest rates, leading them further into debt and poverty. Health conditions, as illiteracy is one of the main factors that limit the awareness among many villagers on basic health and hygiene practices. Public primary healthcare services are limited due to the low national budget. There is still unsafe drinking water in the target areas and sanitation is poor in the villages. The families of poor households tend to have many children. They lack the medicines for treatment. There is a lack of human resources at the health departments with limited assistance and materials for supporting to community people. Social awareness. There is a lack of communication among and between government departments, commune council, community leaders, and civil society groups. Community confidence in commune council CCs is decreasing as they see their community needs have not been addressed. CCs mention that despite their efforts to get assistance from the government agencies and other service providers, they still do not receive support. Participation is low among the poorest villagers during the local planning process, LPP, because they are away and too busy to earn their daily income, or they do not understand the benefit of participating in LPP. Poor families who must migrate to earn their living have low awareness about HIV, AIDS, and the high risks that they are exposed to when they migrate to different towns and cities in search of work. Public services are limited for ensuring that communities understand about this disease. Poor families, women and children are also vulnerable to domestic violence, crime from youth gangs, and drug addictions, which are both on the increased. Part of this is due because the poor families have many anxieties to meet their livelihoods needs. Capacities and roles of women also remain limited in poor households, as there is low gender issues awareness and limited options for women to participate. Natural resources management. Community members have very low knowledge about the environment and sustainable natural resources management. There is lack of awareness about good practices to take good care of the environment. For many villagers, their daily income is from cutting timbers, making charcoal, cutting trees for firewood, thus, depending on the forests of its resources. At the same time, there is increasing use of poisons and other types of trappings for the protected wildlife. Improper use of fertilizers and pesticides is leading to poor soil conditions. and increases the risk of people to become infected by these chemicals. Fishing and hunting is restricted by law during some months of the season, but these are poorly enforced. LHCCO is a Cambodian non-governmental, non-profitable organization established by a group of Cambodians who want to help improve poor kids and women's opportunity of education, capacity building, safety, reducing the traumas, and try to put the most vulnerable groups of the children, women, and the poorest families, disabled people at the better and safe environment. Both staff, locals and expatriates and volunteers bring in their experience working as agronomists, agricultural technology instructors, health, social awareness, education to reintegrate into the local community where people are in the most need of help. LHCCO's expectation is of Cambodia as a country with a growing strong economy and whose people benefit equally and equitably from dependence, unity, and strong respect for human rights and democracy. In order to realize this vision, LHCCO commits to alleviating poverty in rural areas of Cambodia through improving the quality of life of Cambodian women and children and their families by coordinating with all stakeholders, including civil society groups, government departments, and NGOs, and relevant stakeholders at all levels.